Well, as the country faces the fourth wave of COVID-19, southern states are being crippled by daily high case numbers. Mississippi, Louisiana, Tennessee, and Texas are among the areas in dire need now for nurses and healthcare workers.
That's right. Extending shifts, treating ill patients, and going to the next facility is the reality for most travel nurses. Our Stephanie Poole speaks with medical professionals who are traveling the country to help in ICU units.
People are exhausted, they're tired, they're scared of this COVID.
Mentally, everybody's drained, the patients, the staff. We're doing all we can to get them better.
And they say it's only going to get worse if folks aren't doing their part to curb case numbers. Travel nurses from Mississippi are working in top hospitals around the country, like Marie Allen. She's contracted at New Orleans Churro Infirmary in labor and delivery.
I've had 5 COVID patients this week on the floor, and none of them had got the vaccine. One of them's in ICU right now in very critical condition with a newborn in the NICU.
Just a few days ago, Allen's contract was extended until December due to the Delta variant. Right now, her unit is riddled with severely ill patients.
And instead of taking your normal labor load of 2, sometimes I've had 4 patients, not including the babies in the tummy.
In the eastern region of Louisiana, it's the same reality for Mississippi native Claire Ellis. She's working in the Women's Hospital in Baton Rouge.
Looking at the CDC comparison from now and from last year, and just from comparing July in the South to this month in the South, and it's all red.
Case numbers are as high as 4,500 per day. Ellis says there's one way to relieve COVID symptoms for those infected: monoclonal antibodies.
And we've seen good results with that as far as the symptoms, that it lessens the symptoms while they're experiencing the COVID.
LaShonda Randall says personal protection is on the top of her list.
There are some facilities, they give you a change of clothes. You go in, you change your clothes, you get all of your protective equipment, and you go to work.
And you're probably wondering, why aren't nurses staying in Mississippi?
The pay is just so much lower, even for travelers in Mississippi.
Well, I know it's because of the nurse-patient ratios, and the pay, it is better.
But as concerns build, there's one thing nurses are certain of.
I want to provide the best care, whether they had the vaccination or not. I'm going to do everything I can do to save a life.
Reporting in Columbus, Stephanie Poole, WCBI News.